Assalamu alaikum, sir. My name is Syed Mubashir Mahmud. My student ID is 22101500. Our project title is Breast Ultrasound Image Detection, a comparative study of multitask unit and efficient net-based classifiers. Me, along with Tausif Ahmed and Miraj Mahmood, have worked on this project. Breast cancer is the most common cancer among women worldwide, and ultrasound is an important tool because it's safe, affordable, and useful for dense breast tissue. However, ultrasound interpretation is very operator dependent, which leads to variability. Automated deep learning systems can help standardize detection. For this project, we have worked with the BUSI breast ultrasound dataset. It contains three categories, which is benign, 891 images, malignant, 421 images, and normal 266 images. So we can say that not only the dataset is relatively small, but it is also imbalanced with benign cases, making up more than half the total. This makes model design and evaluation especially challenging. For this project, I conducted the background research and literature review on breast cancer detection using ultrasound imaging. Based on that, I implemented a pipeline using EfficientNet B0 as a feature extractor and trained classical classifiers on top. And here's how it works. Every gauge scale ultrasound image is converted to RGB and resized to 224 into 224. And from the code of my project, we can see that the image is passed to EfficientNet B0, pre-trained pre-trained on ImageNet to extract a 1280 dimensional feature vector. And then, instead of fine-tuning the deep model, I trained three lightweight classifiers on these features: logistic regressions, random forest, and gradient boosting. This approach is computational efficient because it reduces the risk of overfitting on a small dataset and is a good complement to our deeper unit model. And for the results, we can say the logistic regressions performed best with about 84.4% accuracy and F1 score. Random forest and gradient boosting achieved around 80% accuracy. These results show that a strong feature extraction, even paired with simple models, can deliver competitive performance. And in the paper, we have and in the paper from the table we can say we can differentiate between the accuracy, precision, and F1 scores between different models. So we can say that logistic regression is the most effective and stable among the three. The method is lightweight, fast to train, and practical for small medical datasets. It complements our multitask unit, which was stronger overall but heavier to train. And in the paper, from the we can see the model performance comparison, and we can see also that, and we can also differentiate between the accuracy, precision, recall, and F1. In short, my contribution demonstrates that efficient net features combined with classical machine learning offers a robust, resource-friendly pipeline for breast cancer ultrasound analysis, especially in data limited settings. And I would request my other teammates to describe the remaining part of the projects. Thank you.
Hello, sir. Uh, my name is Tausif Ahmed, and as you all know, we are presenting on breast ultrasound image detection, where we'll be comparing a study of multitask unit and efficient net-based classifiers. So my primary responsibility in this project was designing and implementing the multitask unit and then integrating results from both pipelines for comparative analysis. We know that UNet is one of the most widely used models in biomedical image segmentation. It has an encoder-decoder structure with skip connections that allow it to capture both local and global information. So for our project, I extended the UNet architecture to perform two tasks at the same time, which is segmentation of lesion masks and classification of the image into one of the three categories, which is normal, benign, or malignant. So to achieve this, I added a classification head at the bottleneck layer, which is here. Um, so I have added the classification head in the bottleneck layer. The segmentation branch reconstructs lesion masks, while the classification branch produces a three-class output. For training, I defined a combined loss function, and the loss functions are, we can see we have here dice loss, binary cross entropy loss, and we also have a categorical cross entropy loss. So we use dice plus binary cross entropy loss for segmentation part, and for categorical, and we use categorical cross entropy for classification task. And how do you calculate this are given in the report, are mentioned in the report. So this multitask setup encourages the model to learn both pixel level and image level features. Uh, as you can see, we have mentioned the epochs here, 50. So the multitask unit was trained for 50 epochs with a batch size of 8 using the ARM optimizer, which is mentioned here. We have used the ARM optimizer, and we also used the learning rate of this. An early stopping was also applied to prevent overfitting, and after training the model, we have achieved an accuracy of 86 of 86.3% and with an F1 score of 85.2%. And importantly, it is also produced lesion masks which are highly valuable in clinical practice because they help radiologists visualize the suspicious region. And we can see we also face some challenges while doing so, and that during early experiments that we at first trained the unit using 2 epochs only, and which is resulting in a very poor accuracy, which is 0.5% accuracy, or less than 50% accuracy. And we extended the epochs up to 50, and as a result we significantly saw a huge improvement in our model training. Now after training the unit, I combined its results with the output uh, I combined these results with the outputs from the efficient based classifier, which is this. And my responsibility was to conduct the comparative analysis of both approaches. We found that unit was superior in overall performance, but it required more computational resource. As you can see, we had to train for quite some time here. It used more computational resource, and um, and training time as well. And on the other hand, the efficient net and logistic regression pipeline was much faster, lighter, and still competitive. And these findings really gave us a clear idea that multitask unit offers a higher accuracy and segmentation, while the efficient net plus classifiers pipeline offers efficiency, only efficiency mostly. I also contributed heavily to writing the methodology, since I try to do most of these parts by myself, and experiments, and also discussion sections of our report. So that was it from my side. Thank you.
Assalamualaikum sir, my name is Miraj Mahmood, ID 24241318, and the end part, my contribution focused on the dataset presentation, pre-processing and experimental setup, and also the preparing for the results. I worked with BUSI dataset, which contained 780 ultrasound images divided into 3 parts, on 33 for normal, 437 for benign, and 210 for malignant. One of the challenges I faced with the dataset that it is imbalanced, beginning with the cases are much more common than malignant and normal ones. To prepare the data for training, I resized all the images by 224 by 224 pixels, normalized them into 0 to 1 range, and stacked the grayscale images into 3 channels for compatibility and the ImageNet pre-trained models. So to address the class imbalance, I applied several argument techniques such as horizontal and vertical flips, also rotations, brightness challenges and changes, and elastic deformations. Those arguments mainly increase the diversity of the dataset and improve the generalization of our model vastly. Also, I created the training validation and test splits, 70% training and 20% validation and 10% for the testing, and supported the hyperparameter tuning. I helped the test different batch sizes and early stopping strategies to find the optimal configurations and for stable training. Another part of my work was preparing for the results for presentation. I generate the tables summarizing the model performance in terms of like accuracy, precisions, and recall. Also the F1 model, F1 score, and dice coefficient. Also help to generate the performance plot that compared different models side by side. These visualization made it like easier to communicate the findings in our report and presentation. Finally, I also contributed to the writing of the interaction dataset and among those photo related topics, conclusion section of the paper, and coordinating the final editing. This included checking formats, cross-referencing citations, and making sure the report followed IEEE standards. So, in summary, my work of the dataset was properly prepared and experimented well structured. The result was presented clearly. In conclusion, our project compared two approaches for the breast ultrasound image detection. The multitask unit achieved the best performance thanks to the ability to combine segmentation and classification. The efficient net plus logistic regression pipeline, however, proved to be strong and lightweight alternative. Our work highlights the potential of deep learning for improving breast cancer diagnosis, but also shows the need for larger multi-institutional dataset to improve generalization. In future work, we plan to explore semi-supervised models to use unlabeled scan, explainability, technique like GradCam, lightweight models for mobile deployment, and parrot learning to preserve and patients' privacy. Thank you, sir.